Why you should always get checked after an accident, even if you feel fine. After a car accident or slip and fall, it's common to think, I feel fine. I don't need any follow-up care. But many injuries don't cause symptoms right away. Hidden joint restrictions, soft tissue strain and sprain, and muscle tightness can quietly develop and cause long-term problems days or even weeks later. Even if you've been to the hospital ER or urgent care, you still need an evaluation. Hospital emergency departments and walk-in clinics are excellent for detecting serious injuries such as fractures, dislocations, or internal bleeding. However, their goal is immediate safety, not long-term function. They typically don't evaluate soft tissue damage, joint mobility, or early muscular imbalance. The kinds of issues that often lead to chronic pain or limited movement later. Hidden injuries, what you don't see. Adrenaline and shock can mask pain for hours or days. Common hidden injuries include joint restrictions that alter healthy motion and decrease function, muscle spasm or tightness from protective guarding, soft tissue inflammation in ligaments and tendons. Even minor impacts can stress your body structure and nervous system without showing obvious damage. What happens to the human body in a 15 miles per hour collision? Even at speeds most people consider slow, such as 10 to 15 miles per hour, a vehicle collision can create forces strong enough to cause significant soft tissue, joint, and neurologic injury, especially to the neck and spine. When two vehicles collide, the body experiences a sudden change in velocity, often in less than a tenth of a second. The car stops, but your body keeps moving, creating a rapid back-and-forth motion known as a whiplash mechanism. Acceleration and deceleration worsen. At 15 miles per hour, the occupant's head can experience forces of 5 to 10 Gs of acceleration, comparable to what fighter pilots feel during sharp turns. These forces cause the neck to snap backward and forward rapidly. The soft tissues, muscles, ligaments, and fascia, are stretched beyond their normal range, leading to microtears, inflammation, and protective muscle spasm, resulting in neck and back pain, headaches, stiffness, shoulder pain, dizziness, and fatigue, which may appear hours or days later. Joint and spinal restrictions. The sudden shearing motion can cause minor joint capsule sprains and facet joint irritation, especially in the cervical and lumbar spine. These restrictions disturb the normal motion patterns of the spine, causing compensations and tension in surrounding muscles. This may also alter nerve signaling in the affected region, contributing to pain, tingling, or weakness, resulting in joint dysfunction and altered posture that can persist long after the initial pain subsides. Muscle spasm and protective tightness. In response to trauma, the body's natural defense is to lock down muscles around the injured area. These protective spasms are intended to stabilize the spine, but they can restrict movement, reduce blood flow, and lead to chronic tightness or trigger points. Over time, this can lead to fatigue, imbalance, and recurring tension headaches. Ligament and disc stress. The ligaments that stabilize the spine, like the anterior longitudinal ligament and facet joint capsules, are stretched suddenly. Even small amounts of damage to the soft tissues can destabilize a spinal segment, increasing the risk of disc damage or herniation over time. MRI studies have shown that even low-speed collisions can produce ligamentous injuries. Neurologic and proprioceptive changes. The cervical spine houses delicate proprioceptive receptors that help your brain know where your head and neck are in space. Whiplash injuries can disrupt this sensory input, leading to dizziness, balance problems, and delayed reaction times. The resulting neuroplastic adaptations can reinforce abnormal muscle tone and posture unless proper motion is restored. Whole body compensations. Even a minor collision can set off a chain reaction throughout the body. Tight neck muscles affect shoulder and upper back motion. Altered spinal alignment changes hip and pelvic mechanics. Compensatory movement patterns cause fatigue and further inflammation. The long-term picture. Studies have shown that up to 30 to 50% of people involved in low-speed collisions still report symptoms months or years later, even when there was little or no initial pain. Why? Because soft tissue injury and joint dysfunction often go untreated when imaging shows nothing wrong. That's why a comprehensive chiropractic evaluation is so important. It identifies and corrects the subtle motion and muscle changes that standard ER exams could miss. A 15 miles per hour collision doesn't sound fast, but to your body, it's a violent event. The spine, muscles, and nervous system are not built for sudden acceleration and deceleration. Even without broken bones, soft tissue injury and joint restrictions can set the stage for chronic pain, inflammation, and neurologic dysfunction unless addressed early. That's why it's important to contact us if you've had an automobile accident, slip, or fall.